All right, Dr. Veith, welcome. It truly is a pleasure for me to spend some time with you. The Atlas Award winner for VIVA, which is the largest award that we have, and to be frank, this has been long overdue for someone like you to be here. So we're very excited. This truly has been very special for us. What do you want to talk about? I want to get to know you a little bit beyond even how I know you.
Well, I mean, recently I've been involved a lot in medical politics, particularly with young colleagues that are going through some adversity. Life is very unfair. People get fired because of bias of administrators or general surgery chiefs that have no real knowledge of what a vascular surgeon does. So I've been trying to, in some instances, help them through the difficult period of finding another job. And it's very gratifying when they do, because losing a job gives you a taint that is very discouraging. So if you have a guy who's trained for 10 years after medical school and worked as an attending at some of those years, and they lose their job, it's devastating and very discouraging, and yet invariably they recover from it and do well.
Well, I haven't had that happen to me, so I don't know what that would feel like, but I can understand the pressures of medicine today and how they lead in one direction or the other. Is this a new phenomena that you're seeing more common today, or the politics that played into this?
I don't know, because I wasn't that involved with it before. Now I have, I guess, more time, although I don't have a lot of time. I have more time and people come to me. And I've made the statement, I think I've even written it, that every good vascular surgeon, anybody who's contributed and done innovative things, think about this, not everyone, but many have been fired at least once. You can look at the biggest names, Rutherford, Bergen, you name them, for one reason or another, because of either conflict with a general surgery chairman, they were too powerful or whatever, they've lost their jobs.
So
Point
well taken. I need to get fired. So let me ask you.
You're not always fired. You're forced out.
Yeah,
let's put it that way.
And I can totally see that. Innovators in the world always do things to discover that might not be within the norms. So along those lines, from when you started your career to where you were midway through your career to where you are today, which probably is midway through your career.
Midway, absolutely.
We'll stick to that.
Yeah.
Did you expect to see the changes that have occurred? And looking back at your perspectives then versus now, talk to us about
I
that.
thought when I made the proposal to vascular surgeons, I happened to be president of the SVS at the time, back in 1996, I thought that I was right on target, extremely prescient about predicting the future. At the time, everybody said I was crazy, that I was much overestimating how endovascular was going to transform what we did. It turns out, not only were they wrong, I was wrong, because endovascular, and coming to this meeting today, I've seen things that I never dreamed were possible. Look what you can do with aortic aneurysms that I didn't think we'd ever do, but we are. And there was the one live case that I saw where they used the lithotripsy on a common femoral very calcified artery. I was convinced that this is going above and beyond what I even thought would be possible. So I think the sky's the limit. And there was a great talk this morning on untethered patients. I think that's the future. Never dreamed it possible. And so the sky is the limit. And the other thing, I think, just because something fails in somebody else's hands doesn't mean that it won't work in your hands. Because you might come up with a slightly different wrinkle, it works, and everybody says, oh, that's never going to work. You must be wrong, you're lying, you're cheating. But you're not. So, I think continuing to move forward and challenge the current wisdom is the way to go. And that's one way that young people can get very quickly recognized, if they're right.
What are we not talking about today that could seriously have an impact on how we offer vascular care to patients?
Lots of things. I mean, care is an evolution. And, it's one little step leads to a bigger step, leads to a bigger step. And that's true in every area. I mean, I think that, again, going back to that talk of untethered patients, we'll have sensing devices that can measure flows and pressures in stents non-invasively. So you just put your cell phone, your smartphone, I don't have a smartphone, I'm not smart enough, but you put your cell phone on a little recording device and people can see that your coronary stent or your SFA stent is failing, and then you do something about it. So I think all these, and I gave the Homans lecture 2 years ago, I think computerized technology is going to change the world. I mean, Ben Starnes' work with, you're going to be able to, if it's commercialized and successful, as I think it will be, you'll be able to send a patient's CAT scan to a company and get back a fenestrated graft with precisely proper fenestrations by mail, by return mail. Isn't that unbelievable? You don't have to send away and wait for 3 or 4 weeks. By that time, your patient may have died from rupture or something like that. I think that the sky is the limit.
And along those lines, tie that to robotics, and God knows how far advanced we can.
Yeah, robotics, the robotics system, Hanson Medical, which I thought was great, didn't work out because of business reasons. And we've had several business initiatives that have failed because we ran out of money. And it's a hard game, but the principle is there.
Yeah.
And if Ben Starnes' system works, which involves 3D printing and that sort of stuff, and computerized algorithms that allow you to take a CAT scan and dial in not only the measurements, but the changes in measurements by putting in the device and a stiff guide wire and all sorts of other things, that's going to work.
Yeah.
And
so let me change gears a little bit. Now that you were a clinician all your life, and somewhere along the line, a few years back, you stopped practicing surgery. What do you miss the most, and what advice do you have for people that go through that transition?
It's been a great transition because for 35 years, I had people who were either dying or, having a stroke or failing, very sick patients. And I never could get away from that. Now I have other problems. I worry about the election. I worry about the tax law. I worry about a lot of political or administrative things, but I don't have somebody dying or critically ill all the time. So I really don't miss the operating. And surgery is a young man's game. You're young, but it's physically demanding. It's demanding because you have to wear the lead, you have to bend over. I consider myself very lucky that I don't have a cervical disc or a lumbar disc. And your vision, your technical ability doesn't change, but your vision, I think, is very important, and that does deteriorate with time, but it's not a problem.
Well, I remember you used to tell me or ask me the questions, how do pelicans die, when we were training together?
That's right.
And the answer was they lose their vision.
They lose their vision, they can't see the fish, and they starve to death. So, I mean, that's why a surgeon's vision, I think, is much more important than what we call manual dexterity. The guys that have the manual dexterity are the dentists, because they work in this little confined space, bad exposure, and if they drill a 0.5 millimeter wrong, 1/10 of a millimeter wrong, you lose the tooth.
That's interesting.
So I think dentists have much more manual dexterity than surgeons, and that's true with catheter guide wire stuff too.
Yeah.
It's not really manual dexterity. It's knowing what to do, when to do it, and thinking it.
And the spatial orientation probably matters.
Yeah, absolutely.
So what do you like to do in your free time, if you have any?
He used to love to windsurf and to ski. And I'm sailing now. I sail a Hobie Cat, which isn't anything like windsurfing. And I mean, when I was your age, well, I was younger than you, I mountain climbed. And I saw a movie recently about free soloing, going up the El Capitan with no ropes, no pitons, nothing. This guy, 3,400 feet or something. Amazing.
Which is amazing.
Which is amazing. That's courage. Courage and skill. And the irony, or the interesting part about that, is he planned every hand movement and foot movement, or he wouldn't have done it. He couldn't have done it. He went up, he practiced, he did it with ropes first. He scouted out the mountain, and that's very frequently what we have to do. I never was comfortable operating on a patient unless I really had thought it all out. And even then, you can't predict what's going to happen.
Yeah, no, very true. Well, Dr. Veith, this is a pleasure to talk to you. I look forward to seeing what you're going to do in the next 50 years ahead.
I'll try.
Thank you.
Okay.
Thank you very much. It's been an honor.